Good morning, good afternoon, good evening, everybody. What a pleasure it is to be with you today. Here we are with a gathered group of people to discuss today pharmacists as accelerants of understandings in chronic disease management. My name's Catherine Duggan. I'm the Chief Executive Officer of FIP, and it's my delight and honour to be working with Sandra Carey here today and some valued colleagues who are going to walk us through this hugely important event. Sandra, over to you.
Well, good morning, good afternoon, good evening. Hi, everybody. I'm Sandra Carey. I am the Global President for IPG Health Experts. We work with pharmacists all over the world and work with organizations and our clients to be able to help elevate the role of pharmacists. And this is such an important topic. If you think about where we are, and the biggest challenges that we're having from healthcare globally right now, there is a lot of room, a lot of need for pharmacists in the role of accelerants in chronic disease management, of accelerants of understanding. What we mean by that is that at the population level right now, there's been a massive reduction in health optimism. There is really, recessionary economies, depleted health delivery system, pandemic wear out are really fueling senses of futility. You look at the individual level, there's tensions between striving for, how do we care for ourselves? How do we manage chronic disease, which we've been ignoring for the last few years, and really about access to care. So what we're going to talk with this wonderful panel about today is what is the role that pharmacists can play in chronic disease management, in screening, in triage, in management of the disease. And we have brought together the most brilliant panel that is going to talk about that. And we're hoping that at the end of this, you're going to take from this, what can you do? What are the things that you can do in your own community with the people that you see every single day that trust you as pharmacists? And to take some of these learnings, some of these thoughts, and really expand it. So we've brought together a brilliant team. And Catherine, I'm going to turn it back to you. We can do some introductions and then we can get into a discussion. And this is really going to be a wonderful discussion to really help as you think about what is your new evolving role.
Thanks so much, Sandra. We have discussed and decided that we're going to hand the floor over to our speakers, but I'm going to take them one by one. I'd like to start firstly with Michael.
Thank you, Catherine. My name is Mike Boyven. I'm a community pharmacist by training. I left full-time community pharmacy about 10 years ago, and now I develop continuing education for a living. So thrilled to be here to be able, with this incredible panel, to discuss chronic disease management and specifically the role of the pharmacist in chronic kidney disease.
It's great to have you, Michael. Lars, ocher.
Thank you so very much, Catherine. My name is Lars Ocher Söderlund. I'm a community pharmacist based in Stockholm, Sweden. On a daily basis, I work as an executive advisor to Apoteket. Apoteket is a pharmacy, a government-owned pharmacy chain. I am immediate past president of the community pharmacy section of FIP and was last year elected as vice president of FIP. It's a great honor to be part of this panel today. Thank you.
We're honored to have you, Lars ocher. Jaime.
Hello, everyone. It's a pleasure and honor to be here with you today. My name is Jaime Acosta, James, however you prefer to pronounce it. I'm a practicing community pharmacist, very proud community pharmacist and pharmacy owner. In fact, I'm in my pharmacy now and I hear my staff rushing and running and taking care of our patients. I'm also lucky enough to be the professional secretary of the community pharmacy section of the FIP and the FIP Technology Forum co-chair. Thank you for having me. It's a pleasure.
Thank you for coming. And last but not least, Karina.
Great, thank you, Catherine. Well, I feel definitely honoured to be part of this expert panel today. My name is Kristina Morley and I head up the External Scientific Affairs team at AstraZeneca across cardiovascular, renal and metabolic disease in medical. And, I'm really excited to be here because I think the evolving role of the pharmacist is going to be key to managing chronic diseases in the long term. And I think this group can definitely help the industry understand what are the things that we need to do different in the future to partner with organisations like IP, etc., to really make how we advance patient care and make sure that patients are getting the right outcomes when they're being managed with chronic illnesses. So I'm incredibly excited to be here, and I'm really looking forward to a fruitful discussion.
Thanks so much, Karina. It's so important for us to make alliances, partnerships, and to do things in collaboration. We've learned that through the pandemic, so we're delighted to have you. Sandra.
So, Catherine, when we're thinking and we've got, we've just heard this is a great team to bring together leaders in the industry, leaders in, pharmacy. I've been a practicing pharmacist for many years, and I can tell you, it really is interesting when I think about pharmacists based in the community and that unique position that they can use to increase even something as simple as chronic kidney disease, right? Like the awareness. Let me ask you what, and before we get into the full discussion, and anybody can answer this, but why are pharmacists that are in the community in such a great position to be able to step in and help increase awareness, help increase management? Your thoughts, and anybody's thoughts would be wonderful.
Sandra, I couldn't agree with you more. I think there's something here about, first and foremost, the eclectic nature of community pharmacy, where as a pharmacist in the community, we shouldn't define ourselves by the walls within which we work, but a pharmacist working in the community has to manage and triage anyone who comes in with any kind of complaint or illness or symptom. And that provides, well, it can be quite stressful at times, but it provides a huge opportunity for pharmacists. And if you think about that on every high street in every community across the world, it's no surprise to us at FIP when the pandemic hit and the lights remained on, that suddenly the profile of the profession, which perhaps we've been underselling for a few years to health ministers and to patients in the public, well, with everyone else shut, the profile of the profession just shone and shone. And the pharmacists didn't ask for permissions. They didn't ask what they should be doing. They just did it. The second thing, Sandra, I don't think we can underestimate is the position of the pharmacy in the community as an employer of health workers and health workforce from that community. So the understanding of the community in which that pharmacy is based is integral. And there's something there about being able to identify with the public that you're serving and the patients that you're serving. Perhaps if you're lucky enough to be in somewhere quite small without a transient population, you can even get to know your customers, your clients, and your patients really, really well. And that needs to be actually, I think, emphasized more and more and more. We saw that in the pandemic when perhaps at different stages, patients in the public just came in and asked the pharmacist every single thing to do with health, whether it would be about their care home, whether it be about their children, whether it be about schools. And people who'd never used a pharmacy for those things before suddenly found the pharmacy and the pharmacist and their team to be accessible, to be expert, to be experienced, and even, may I say it, when they don't know the answer, they can find out for you. And that's something I think the community really valued and trusted. So what we've got is coming through the pandemic now is almost like the perfect situation for community pharmacy to be positioned as experts, but also as expert triagers, and then the support as somebody might move in and out of chronic and acute care, Sandra. So I'm looking forward to hearing this, but may I say that this has happened globally. There is no country around the world which hasn't seen pharmacy shining during the pandemic. I know we're talking about community here, and I'm delighted to see we've got education, community, pharmacy owners, and industry around the table. But Sandra, also, the whole of the profession really shone throughout the pandemic, from pharmaceutical scientists all the way through to educators, to our industry colleagues, to hospital colleagues, to look at those emergency and military colleagues who work on the front line. Literally everybody stood up, stepped in, and delivered, and we can be super proud of that.
That's amazing. And just to add one point to that before we move to our esteemed panel, many health systems were built on a paradigm of structured, it's a fixed healthcare system of primary, secondary, and tertiary care through institutions. And what we're seeing is a massive shift from institutional care into community-based home care. And we're seeing money being shifted from those systems because not only do patients want to be sitting in their communities and being more empowered to care for themselves, but we're also seeing that the health system, all of the gaps as a result of COVID. So, chronic disease management, understanding early identification, earlier diagnosis of things like chronic kidney disease really are important as we see that shift from health systems and institutions into community-based care, where pharmacists really have the role to play. So with that, I'll ask a question of Lars, and that being a community pharmacist, being a leader in the industry, being so prominent, seeing what's happening around the world, Lars, what role can community pharmacists play in chronic disease management that you've seen? Even some examples in best-in-class, approaches that you've seen.
Thank you so very much, Sandra. Well, I would say that during the pandemic and also before and afterwards, I would say that pharmacists have actually an expanded role in the prevention of non-communicable diseases. As we know, the WHO estimates that 36 million people die annually from NCDs, and with those above 65 years making up the majority. But pharmacists working in the community can provide NCD prevention services through patient awareness, education and counseling, risk factor identification, coaching and supporting lifestyle changes in areas such as nutrition, weight management, and smoking cessation. And we have so much evidence showing the clinical outcomes in patients where pharmacists have had to lead preventive interventions. For example, patients with high blood pressure and high blood cholesterol levels participating in pharmacy-based education and therapy management program recorded much better outcomes, improved medication adherence, and decline in cardiovascular events. So I would say that community pharmacists are uniquely placed to deliver early screening and detection services. And one way to prevent actually disease progression is through early screening and detection, because pharmacists working in the community pharmacies, they are uniquely placed to conduct early screening and symptoms using point of care measurements such as blood pressure, blood sugar, or cholesterol levels and waist circumference, and to make timely referrals to physicians when it's needed or when it's appropriate. And also pharmacists, moreover, can provide disease state management services to NCD patients with the aim of preventing aggravation of the chronic disease. And overall, I think we need to link it to the new model or to the future of primary healthcare because they are so interlinked. And as such, I think it's very important to have like a collaborative approach to NCD management. And we also need to focus on prevention, screening, and referral from the community pharmacy, and as well as better treatment outcomes, link it to better treatment outcomes. And of course, in some countries, we also face key barriers and challenges to the full utilization of pharmacists in NCD care. And where this is present, we need to fight even these barriers to make it possible for community pharmacists to be sort of the resource in fighting NCDs in our communities.
That's great. Catherine.
I'm going to follow up and ask Jaime the next question. And what role do you think, Jaime, community pharmacists can play in covering interventions of chronic kidney disease? I think this builds very nicely on Lars Ocher's words before.
Yeah, thank you for the question. Yes, so you were talking about the advantages and highlights of community pharmacy, and I could spend hours talking about this, but I'll try to make it short. The first and foremost, the most important one is the trust that people have on us. There are various national rankings on what profession do people trust more, and it's always in the three first places. It's always pharmacists, nurses, and firemen. and firewomen, of course. Politicians go all the way in the ranks, always, but it's always pharmacists with nurses and firemen and firewomen. And that's for a reason. It's not only about accessibility, which is super important, not only geographically, but also in the opening hours, late in the evenings or at weekends. But for me, it's very important that we provide a convenient and less formal environment than other resources. We know how to talk to people in their own words, and they come to us just not, sometimes, don't get me wrong, but not as a healthcare professional, but someone that you can talk with and you understand what the pharmacist is telling you. And I know my customers, my patients from the voice. The moment they enter the pharmacy, I hear the voice and I know who they are. I know their families, their history. So we are so much into the community. Of course, there are many different kinds of pharmacies, but it's not extraordinary to find those pharmacies that are so much embedded into the communities. So people come to me with their nephews now for health advice, and I was advising them 20 years ago when I opened my pharmacy, and that fills my heart. Now pharmacies have dedicated consultation areas specifically for private discussions, and pharmacies are really a resource you have to count with to scale up screening, especially also in low and middle income countries where infrastructures might not be so advanced as in Western or more advanced countries. And there are several studies and publications on the role of community pharmacists in screening patients for various non-communicable diseases. Although sadly, for the moment, most of them are open and uncontrolled studies. They also show the feasibility of using pharmacists and the skills of pharmacists to screen these conditions in the community setting, which is, of course, a big advantage to reaching patients. The results of the mentioned studies suggest that if there's a screening intervention at the community pharmacy level, as Lars said, there is a prompt referral of suspected cases to a general practitioner or specialist, increased disease awareness, and a higher patient willingness to initiate and adhere to treatment. These studies also indicated that community pharmacist interventions were associated with high diagnosis rates and with, related to what Sandra said about the need for efficiency, a more efficient use of GP visits, namely by avoiding unnecessary referrals. So we are so much ready to help our healthcare systems and our patients, also in the screening.
You know what? It's just to add one point to that. It's pharmacists are a part of the community, right? And Jaime, you just said that. It really is such a critical role. You're not going into a health system where you don't know anybody. You know people by name. They know you. They see you in their community. At the same places they go, and that level of trust is something that is required because we have a lot of patients that don't want to address their chronic disease issues, that don't want to become familiar and understand in any more depth than they have. I think they're afraid to understand their chronic disease. So that in itself is such paramount importance that, so great example and thank you, because that really does make a difference. I'm going to ask Michael, and Michael and I have worked together for a long time. Michael, you've been involved in education and you've been a practitioner yourself. What do you think are the challenges and opportunities when it comes to facilitating awareness and screening of chronic disease? And I know today we're using chronic kidney disease as an example of that, but what is one of those conditions? What do you think are those challenges and opportunities?
Well, let's start with the challenges first, Sandra. Like the key things here is we see is there's pharmacist challenges and then there are patient challenges with doing this. From a patient standpoint, it comes down to really this is an asymptomatic condition, just similar to hypertension. And if you talk to your patients and you ask them, tell me are you worried about your kidneys? Until the patient actually is experiencing symptoms and has significant damage, nobody ever talks about what their kidneys look like. So it's a real fundamental issue of increasing the knowledge of why this is important. Also, it's patients feeling comfortable with pharmacists taking on this new role. It's something new depending on the part of the world that you're in. So it can be a challenge from that standpoint. But really, we see some challenges on the pharmacist side. And the ones that I always hear from when I'm talking and teaching colleagues, it's always about time as being the number one, knowledge, which a lot of times we have. But the fundamental thing is comfort level. They're not necessarily comfortable with taking on this new role. And I think that can be improved by education, looking at other examples. So similar to what Jaime is doing within his practice to improve the overall care that they're providing to patients. Now with CKD or chronic kidney disease specifically, one of the issues we have in many parts of the world is pharmacists don't necessarily have access to laboratory data. I live in Canada. We have access in most of our provinces where pharmacists can not only access the patient's readings, but actually order those laboratory readings to check to ensure those patients are adequately controlled. Also another barrier is just working with our colleagues. So if you're working from the standpoint and we identify a patient with chronic kidney disease, is referring this patient into their physician. So it's that interprofessional collaboration. I work continuously with physicians. Never in my career have I heard more physicians thanking me and thanking pharmacists for the role that they play. So it's really an opportunity for us to build on that goodwill that we've established through the COVID-19 pandemic. Now, in terms of opportunities, chronic kidney disease is the 10th leading cause of death in the world. People don't think about that, but it really is a major issue. We have easy access. Jaime has mentioned it in his practice. He knows all these patients. It's the only healthcare professional where you don't need an appointment. You can come up and talk to us really at any time. And we know through the pandemic that many of our patients have fallen through the cracks, not only from a screening perspective, but also in a chronic disease management. So it's really an opportunity for us to really get them back on track to ensure that these patients are cared for. What's nice about chronic kidney disease is that anything that you're already recommending for cardiovascular disease are pretty much the same thing. It's always about what are you eating, how much your physical activity, let's manage your blood pressure, let's manage your cholesterol, let's make sure you don't smoke, let's get your weight under control, and looking at individualized therapies to control those as well, and looking at kidney protective therapies such as SGLT2 inhibitors. And the way I teach my colleagues is that if it is good for the heart, it is also good for the kidney. So it's not really a huge training to be able to go up to that next level. If you're doing it already from a cardiovascular perspective, you just have to sub in for chronic kidney disease and you can make a huge difference.
That's great, Michael. I just have one more question. Sorry, Catherine, can I interrupt again? I mean, honestly, you know what I'm like. Michael, just one question though. How comfortable are patients asking pharmacists? How can we increase the patient comfortable levels in asking us those questions? Because we are a resource that they have access to right in the community. And, I look at Jaime, I look at Lars. I mean, all of those are practicing pharmacists in the community. How do we help those patients?
I think the fundamental issue is not the patients, it's us. We don't necessarily have the comfort level to feel that we need that component. So the biggest issue is not the patients. The patients, if you come up and say, do you want to talk about something that can improve your overall health? Most patients will accept that component. It really is a fundamental issue, is that us not feeling that we provide necessarily the value to actually talk to or make a difference in that individual patient's life. So it's a pharmacist issue, not a patient issue most of the time.
Thank you, Michael. Catherine.
Oh, thanks so much, Michael. So you're basically saying it's a confidence and a competence issue there. I see, Lars, okay, you've got your hand up before I move to Karina.
I would like to make a comment. I think it's so important nowadays that we actually act together, because together we are stronger. And that means that we also need to use the competence, for example, from the pharmaceutical industry, because together we can actually manage these challenges. And, linked to our comment here about the challenges in some countries, actually lack of adequate access to pharmacists due to the severe pharmacist shortage is jeopardizing the health of patients with NCDs. And in those countries, government action is actually necessary to increase the supply of well-qualified pharmacists to ensure patients have access to pharmacists provided patient care services for NCDs. And I mean, the evidence is very strong concerning the value of pharmacists' contribution to the NCD prevention and management, and also the quality use of medicines, because it's partly about prevention and management and also the quality use of medicines. And adequate, you can say, recognition and remuneration of such contributions, both by public and perhaps by other private third-party players or payers, could play or could lead to the consolidation of these roles, including activities such as pharmaceutical care based on individual needs, identification and resolution of medication-related problems. So I think that the stronger we are together, and we also need to fight these challenges in order to make pharmacy a key asset in the fight against NCDs.
Yeah, there's definitely a psychology there, isn't there, Lars, about thinking of a challenge as an enabler.
Yes.
And for all of us to really join shoulders to try and overcome that. Super thoughts. Jaime, you've got your hand up before I move to Karina.
Yeah, so thinking about what Michael just said, so some diseases and conditions and risk factors that facilitate chronic kidney disease are very much commonly seen in community pharmacy. You've got diabetes, high blood pressure, cardiovascular disease, smoking, and obesity. That's what our patients are in our pharmacy. So there's a big opportunity for us, especially in those jurisdictions that pharmacists are providing structured services to those patients, just to include something which is, I was very much amazed when I read the figures about the impact that chronic kidney disease is making in healthcare and patients, of course. And it's strange to me that we are not much focused on this topic as we are now. So we are getting to those patients on a daily basis, and someone, probably the community pharmacist, is the best healthcare professional to go to them and try to find those asymptomatic patients that are beginning their kidney disease, and there's so much value also in identifying them also through our structured services that we are already providing. So I don't see that it's super difficult. It's just being focused into that.
And we often see people before they even enter the system. We see some of those signs, we see some of those symptoms that, they don't get to see their physicians. One of the stats I read is that patients see pharmacists, depending, an average between 14 and 35 times a year, depending on, where they are and that kind of thing. So just thinking about those number of touch points and having conversations, what a great opportunity it is for pharmacists to really help starting to identify chronic kidney disease is one, cardiovascular disease, all of the things. But, and I know the focus today is on CKD, but it really is fascinating when we think about the number of times and how early we can start that intervention.
Super, thank you so much. I do love these side conversations. And I think this is really important, actually. It flows very nicely into my question for Karina. Karina, what role do you see pharmacists can play in early intervention or increased awareness of CKD? And taking on board what Sandra, and in response to other comments, roles in wider chronic diseases, though CKD is our focus for today.
Yeah, no, thank you, Catherine. I think, we're using CKD today, but I think any diabetes, hypertension, I think, pharmacists, and there's a lot of published evidence to show that when pharmacists do look after chronic illnesses, you see a huge economic, clinical, and humanistic benefit of for patients. So I think there's a huge role. I guess the challenge in some countries is, pharmacists are not widely recognized as a first-line healthcare professional, and I wonder, is there a challenge around policy reforms in countries that needs to be tackled as well as trying to get pharmacies to take on extra roles? And then, of course, Michael talked about some of the challenges with pharmacists, being able to do additional roles. But when it comes to chronic disease, if you look at patients who are more often likely to get chronic disease, like kidney disease, you're talking about the diabetic patients, the hypertensive patients, and Sandra just mentioned around the diabetic patient going between 14 and 35 times per year to pharmacists. So in a way, who better to tell the patient, have you had your kidneys checked? When was the last time you had a blood test? There's also online quizzes now, like done with the International Society of Nephrology, around are your kidneys healthy? And it's about 6 questions to determine how at risk you are. And in a way, the pharmacist has a very simplistic role to play and say to the patient, can you just take this test? And then it prints out, a document to say you're either low risk, medium risk, or high risk. But also pharmacists are great at doing risk assessment, especially around things. I remember a long time ago working on obesity, and then when the patient would come for their next anti-obesity script, the pharmacist would weigh them, and then if they were continuing to lose weight, they would give them their next script and give them some dietary advice. So, there are many, many chronic illnesses that pharmacists have a huge role to play in, but I guess it's not just pharmacy, there's pharmacy assistants. And how do you, I suppose, educate the whole pharmacist on doing some of this, softer skill stuff with the patient so that they do something different than the patient does go to their GP. And of course, the relationship between the pharmacist and the GP, the local health service, healthcare centre, is critical as well. And I think that has increased substantially over the last 2 years, where the pharmacist and the healthcare professionals in the GP surgery are working even closer together. So I think there's huge opportunities now, and the time is probably right for us as an industry to see how we can partner with organisations around what resources that we can help them, as we would do with any other healthcare professional.
Well, thanks so much, Karina. Before I hand over to Sandra again, I think understanding the utility of some of those tools would be super. And I know that our pharmacists that we can access through our networks would really value being able to avail of them. So you're quite right. I don't think any sector or part of the profession can answer these questions on chronic disease management, NCD management, prevention, the whole piece on its own. I think we really need a joined up systematic approach. Sandra, over to you.
Yeah, I'm just going to add a point to that. And, I can't help myself, right? So if we think about where, in the US, and I'll just give this one example. In 2020, there were 1 billion diagnosis visits that didn't happen. In 2021, there were 229 million approximately. When we think about what you just said, Catherine, and it takes a team, I don't think it's pharmacists. I think it's pharmacists working in collaboration with the full interdisciplinary team in the community and in the health system. And I think what we've seen is they've come much closer together since COVID. Physicians seeing the benefit of the role, what we can see where pharmacists can play. We know we're moving into a workforce shortage, over the next few years. So all of those things are going to come into play, and the role that pharmacists will really kind of step into and are starting to step into is so paramount for the health of our communities. So I just wanted to add that point, because it truly is about building that full interdisciplinary team, as Karina said, and there's lots that we can do together. Lars, I have a question for you, thinking about just that statement and what could be the benefits to the overall healthcare system if we think about the role that if pharmacists, start even more, and we're hoping after this, webinar, they're going to actually, everybody's going to put up their hand and say, I want to do this. But stepping into that, what could be the benefits to the overall healthcare system if and when pharmacists step into those roles?
Well, I think that, thank you so very much, Sandra. I think that pharmacists' participation in NCDs and the management of NCDs means, for example, easy access to care and educated healthcare staff. It means decreased pressure on our healthcare systems, and it means also increased focus on preventive measures, which will increase actually the opportunities in creating a more sustainable healthcare system. Because linked to the pandemic, I don't see that there is a way going back. We need to create a new normal, and we need to create the new primary healthcare model. Because as health systems continue to, you can say, buckle under the pressure of rising demand and diminishing resources, healthcare is becoming a team sport, as we said earlier, requiring coordination of care and preventive services. And pharmacists are moving quickly into this area, and where we also find our new roles together with other healthcare professionals. But the pharmacy profession has been underutilized and undervalued, perhaps as well, during many years. And I believe that we now need to convince other team players and stakeholders of our value. Now is a great time to do it, as roles and responsibilities of healthcare professionals are changing, and to meet the changing environment and the increased needs. Because primary healthcare is also the entry point to personal health services. I mean, for most people in every country, and an essential component of the health system. It also provides services with a, you can say, family and community orientation, linking both public health and personal health. So good quality primary health care has been linked to increased access to services, better problem recognition and diagnostic accuracy, a reduction in avoidable hospitalization, and better health outcomes. So pharmacy actually contribute a lot to the healthcare system by working with NCDs, and based on, you can say, a common healthcare team framework. I think the 4 C's of primary healthcare: first contact, continuity, comprehensiveness, and coordination. And this articulates for me very clear the impact of comprehensive medication management and services delivered by community pharmacies. Thank you.
You know what the good news is? That's amazing. The good news is we're starting to see regulators expanding practice. We're starting to see governments. We're starting to see payers. Probably not swift enough, but it's all starting to happen. And I think the more pharmacists step in, to your point, the better it'll be. Yeah.
Yes, and I also think that we need to revisit every national health strategy to see if pharmacy is included and to what extent, and what are the objectives, in which areas are we going to work, etc. Because I know in many countries, for example, self-care is not included in the national health strategy, and it has to be.
It does indeed, Lars Ocher. You know, I think there's something here, isn't there, for FIP? I'm making notes, Sandra, about what we can do. And we've got a long planned Health Ministers Summit next year, where we wish to provide evidence of impact from different countries and different regions on prevention, NCDs and safety. And this part is right in the middle of all 3, I would argue. So, you know, where one country does it well, surely another can learn. And the whole issue of our development goals, number 21, is sustainability. There's no point us starting services if we don't resource them appropriately. Yeah, I can see a lot of strands coming together, which gives us a lot of work to do, colleagues, which is all the purpose of such an event. I'm going to move to Jaime now. And speaking of countries, sorry, Lars Ocher, sorry.
Actually, I was just going to say that it's also linked to universal health coverage. And I would say that there is no primary health care without pharmacy.
You know, one of the things that we've been saying internally across the boards and across the bureaus at FIP, Sandra, is universal health coverage translates in FIP as universal pharmacy coverage. So let's try and see what we can do to enable that to happen. And I'm really interested to ask the next question of Jaime, because it follows really nicely. You'd think we would have thought it through, Sandra. Speaking of sharing practice, learning from each other, do you know, Jaime, any country case examples of having pharmacists doing triage?
Yeah, well, there are a few described in the literature, many actually, but in the interest of time, I just will cover a few of them I found more interesting. They vary very much in the terms of techniques they use, the CKD risk factors that they target, because we know that there's no value at the moment in trying to reach the whole population, but only those that have the risk higher. There's more value in that. So pharmacists worldwide use dipstick urinalysis. They estimate the glomerular filtration rate, which actually is just doing a very fast blood test to measure the creatinine levels, where pharmacists are authorized to do that. Of course, they should be confirmed by a laboratory measurement, a proper laboratory measurement. But also, it's very interesting when I did research on this, that pharmacists worldwide are using like risk assessment and referral strategy only without doing any measurement in the pharmacy. I was also very excited because I'm very much focused into technology about the new technological tools that are being used to detect potential chronic kidney disease, especially deep learning tools that use retinal photographs to try to identify potential CKD patients. And of course, that brings a lot of value and a lot of volume and a super big reach to many patients, as long as there's an evidence proof that it works, of course. But pharmacy raises that into the next level, trying to reach the right patient, explaining the result of the test, and especially referring to a GP or a specialist. So we can work together with those tools. So just to be short, just 3-4 examples that I found. The first one is from Spain, actually just a few weeks ago in the north of Spain. It was the official association of pharmacists of Álava, a region in the north, with the association for the local association for the fight against kidney diseases. They carried a recent campaign on the occasion of World Kidney Day, which is very useful to market these services or these practices. So actually, they did free of charge glucose, creatinine, and blood pressure determinations to people in risk. And they, out of just 174 people that underwent these free tests, 24 were referred to their GP. So that's a big number, I think, a good number. Michael talked about Canada, pharmacists having access to lab tests. That's what they did in Alberta a few years ago. They pharmacists accessed the lab test results from the patients that were in risk. And for those that did not have a creatinine measurement, they ordered this lab test and then referring the suspected positive cases to their GP. In Australia, about having like a risk assessment program, a community pharmacy program was developed. They developed a calculator with a predictive algorithm developed to identify patients at increased risk. And the algorithm used many predictors, including age, gender, hypertension, kidney stones, and family history, among others. And this calculator allowed pharmacists to perform risk stratification in community patients, and enabling identification of those patients who needed further diagnostic testing. Interestingly, and we're talking about incentives for pharmacy services, I won't get into much detail about this, but it's very difficult to try to introduce a new service in a pharmacy, but it's even more difficult to have it implemented in the long term. So patients were asked if they would pay for this service of screening, and 63% said that they were willing to pay for it. And to finish, in France a few years ago, they screened people with risk of having CKD, and just asking them questions and referring them to their GP. And 10% of patients of more than 500 were referred to the GP. So there are many variations in the way that the community pharmacists can reach the right patients, and there's a difference in the tools that we are using worldwide.
That's amazing. We absolutely, and we should put those up, Catherine, some of those examples, so that anybody that wants to go in and look and maybe have some links. But it's just there is so much, and you're right, Jaime. One of the things we just did with Karina's team was launch a tool in Canada for CKDs, for CDEs, for certified diabetes educators that work in pharmacy, to be able to screen patients for CKD and refer them to the physician. And it's an interactive tool. So there's lots of best case examples out there where we should share, and we should do that, Catherine, after this, is share some of those examples so that pharmacists, if they need these tools, because one of the things I think between technology. You mentioned the retinal scan. There's the ability to do, we're working with a group in the US right now that can do CAT scans in the back of a van, right? Where and using community pharmacist as that go-to point. So it's amazing. Thank you for sharing those. And those are just the tip of the iceberg, right? There's so many best-in-class examples out there, which is amazing. Did anybody want to add any more examples? I know, Michael, you've got, you do a lot of programs where, is there anything anybody wanted to add before we move on to the next question? Because I think pharmacists understanding what other pharmacists are doing is a great springboard for them to be able to get to do it themselves.
Yep. Go ahead, Lars.
Yeah, I was just going to mention that I shared the link in the chat box. FIPD developed 2019 a very interesting report called Beating Non-Communicable Diseases in the Community, the Contribution of Pharmacists. And in that document, we also have several examples from all over the world regarding the contribution and the outcome of the pharmacist collaborating with the patient. And I also would like to mention that I think it's important that we collaborate with the patient organizations. I have a long experience of doing that in Sweden in the national project Check My Medicines, where actually when we advocated for the patients, actually they started to advocate towards the politicians for pharmacy and pharmacy services in order to gain better health for them. So, I mean, collaboration was key and it was extremely successful and still is. We continue this project. It's not a project any longer. It's a long-term collaboration with the main organizations for retired people. So we have about 1.6 million people supporting pharmacy in different perspectives. I think that's important as well.
The only thing I want to add, Sandra, is that I look at a lot of the studies that we've seen, and that is for a lot of clinicians that are practicing at the highest level of our profession. And I know there's going to be people watching this who are going to say, there is no way, I don't have that in my scope, I don't have my patients aren't ready for this, there's no way I can do this. But I can tell you, you can make a difference. Focus on something, start somewhere. So for me, looking at chronic kidney disease, and I do a ton of work in diabetes as well, is one thing that we're really good at. We all have blood pressure machines. We can assess for patients for hypertension, manage hypertension, ensure our patients are adherent. If you do this, you will reduce the risk of cardiovascular disease in these patients, chronic kidney disease in patients, and improve outcomes in your patients with diabetes. For chronic kidney disease specifically, it is not strictly about their EGFR or serum creatinine levels. We're also looking at albumin and creatinine ratios. It's crucial for the diagnosis of this disease as well. So patients can have either a low EGFR or elevated albumin to creatinine ratio. And you say, well, Mike, I don't have that within my scope of practice. How am I going to do that? If you do one thing, starting tomorrow, is all your patients with diabetes, most guidelines across the world are recommending assessment of albumin to creatinine ratio at least annually. So the only way that can be assessed is not by a blood test, but by a urine test. So for your patients with diabetes, simply coming up to them and saying, Mrs. Smith, have you had a urine test within the last year? And if they haven't, refer them into their GP and be able to get that done, because this can actually improve the outcomes for your patients with diabetes. It's simple. It's focusing on something and moving to the next level and always building upon your practice. You don't necessarily have to be the top practitioner now, but focus on one thing and then move to the next step.
Love that. That's amazing. Karina.
Yeah, so I guess that probably brings me to probably one of my most important questions for this panel of experts is, so as an industry, so we've kind of talked about what the pharmacist needs, and then, there's different personas of pharmacists. Michael, as you've mentioned, there's the person who'll do probably, a little bit, and then all the ways up to someone doing diagnostics. I guess as an industry, and how do we partner with big organizations like FIP and other national organizations in countries? If we were to do things over the next 12 months, what could that look like from our side? Because I think, we know how to do some things really well, but I think when it comes to pharmacists, I think we're probably not quite there yet. When it comes to what do they need, how can we help, and what would be the two big things that we could do for the next 12 months in the short term to help pharmacists around things like chronic kidney disease?
So from my perspective, I think it's always about education, and I come from a level of bias as my focus in terms of my career. I find that the issue that I think most pharmacists need is some help in terms of the support of how do I engage my patients within these conversations. We've seen it with the terms of the overall studies. So it's how do I collaborate with patients? How do I collaborate with physicians and nurse practitioners within my community to ensure that we're actually leading to those outcomes and working on that collaborative approach as a team. So it's focusing on everybody together, a single goal of improving outcomes for patients. And then I think that one of the issues that we've seen in terms of industry in the past is that pharmacists were always that second, I'm going to get them later. And we see some of the issues where, the discussions that come out with new therapies in terms of where they fit in terms of the overall role, we're going to focus on specialists and GPs first. And then by the time it comes to the pharmacy level, many pharmacists are not aware of where that potential role is. So I think building out a strategy in terms of helping pharmacists know of this is where we're going to build out. These are what your patients may be getting. And then we're going to work together to ensure we can improve the outcomes for these overall patients.
That's great. I just want to add one point to that. I find in a lot of the work that we do that pharmacists really struggle with initiating those conversations around chronic disease. So, Karina, anything that you can do and maybe thinking about how to help efficiently, that pharmacists are extremely busy in their other tasks. So are there any tools, any digital tools? Are there any things that we can do to help them learn how to really initiate those conversations, have those conversations in an effective, concise manner? Because we don't often have the luxury of time. So what could that be? Those are just some thoughts on my behalf as well. But those are great. Thank you, Michael, and thank you, team. I just want to go back to one thing. Mike, you'd often do a lot of training programs that really could enhance. Are there any that stand out for you that, and you said, education is where you focus, but are there any that really stand out for you where you've seen them work with those training opportunities? What from your expertise do you think, just building off what Karina just said, could be a good place to start?
I think there's a lot of, in terms of CKD or diabetes management, so we focus on chronic kidney disease here. We have excellent guidelines from across the world in terms of the management of chronic kidney disease. KDIGO, which is focused in the US, is an excellent, very good visuals for helping clinicians of where does ACE inhibitors or ARBs or statins fit into our patients, or where does SGLT2s fit in to end up helping our patients with chronic kidney disease. The issue is not necessarily about how do you manage chronic kidney disease, although there'll be some pharmacists that are unaware of those gaps. But the fundamental issue is then how do I implement that within my individual practice, where I am in terms of my management spectrum. So if I'm not necessarily comfortable, how do I start that conversation? And as I mentioned, asking patients about a urine test, asking patients about when do you have your last blood pressure check while you're waiting for your prescription. Why don't we check your blood pressure here and see where you're at? And then we can see how that is going. Focusing on adherence to these therapies. So ensuring these patients are taking them regularly. We know that 50% of patients in chronic disease management are not taking their medications as prescribed. So something as simple as that can make such a huge difference. But for me, I look at it as really starting somewhere. So it's whether it's screening, which Jaime was really focusing on. So looking at screening for hypertension and diabetes for patients at risk, cardiovascular disease, making sure patients are getting the urine and blood tests, encouraging them, especially during the pandemic. Many of these patients have dropped off, to ensure that they're going back for these testing to see and evaluate. Because a lot of times we'll have no idea that their kidneys are failing unless they have these tests. Then the other thing is evaluation of therapies, making sure the patient's on the appropriate blood pressure medications. Are they taking a statin therapy to lower their overall cardiovascular risk? And then potentially an SGLT2 inhibitor to improve the outcomes from patients with chronic kidney disease. And then for me, it's all about education. So even if you don't feel comfortable necessarily with the pharmacotherapy, you can talk to patients about dietary management. So watching the sodium within your diet, watching in terms of the food that you eat, and making good, healthy lifestyle recommendations for patients. 30 minutes of activity most days of the week, that's standard pretty much across the world. It's something relatively simple that you can recommend to your patients. And then finally, it's monitoring. These patients, when they make these chronic disease diagnoses, they feel like their world has completely changed. We see it every day, but they're living with it every day. So it's monitoring these patients and guiding through this process and answering these questions, because what they know today or their needs at diagnosis are very different 1 year, 2 year, 3 years down the road. And you can really be facilitating that by, again, providing them education and the resources they need to improve their overall outcomes.
And you know what, Michael, they have a lot of questions. Patients have my entire family apparently has chronic kidney disease issues, and it's a full-time job. Just even answering what type of cough medicine, how much salt is in this. Like, there's so many roles that pharmacists can play. It's really important that we really engage with patients. So that's great.
It can make such a huge difference. We always look for really big wins. Like, I found this major drug interaction and that it made this huge difference that this person didn't get these 2 drugs. But in reality, having a patient have their blood pressure under the recommendations, depending on your country, can have such a huge impact for that individual over the course of their life. You can make such a huge difference. Instead of something short term, it's over their life and the way that they lead those overall outcomes. So that's where I really want pharmacists to start to focus on. It's not about necessarily the short-term wins, but engaging those patients in terms of this long-term process.
I'm going to call you after this to get tips on how to control my blood pressure, Michael. All right. Catherine, over to you. Oh, that's sorry. Jaime has a question. Yeah.
Well, I was just going, while Michael and Lars and Sandra were talking, I was thinking about implementing different pharmacy programs in my own pharmacy. And of course, education is super important. We have to have the information to serve our patients, but we need to have a registration tool, a referral tool to the GP or the specialist that eases our life, and we make so we are sure that the patient is going to be followed up in the first stage at least. We have to have access to the patient's data, or at least to identify the right patients that we need to reach. The incentives are very important. You said, Sandra, that we are very busy in the pharmacies, and the programs work better when there are incentives for the pharmacy teams. Not only, I'm not talking about money only, but maybe you can do like a gamification program that works very well, and it's not that expensive. Celebrating success, measuring the KPIs, not only in the pharmacy, so I'm sure that I'm doing a good job, but also in the full of the program, and I can compare myself to other pharmacists. And regarding the education tools, they have to be convenient, accessible, they have to be very practical, so it's not too much theoretical, and they have to be fun. That's very important. And again, gamification, I think this is very important. I helped to develop a couple of educational programs for pharmacists, and that makes a complete change. Thank you.
Lars.
Yes, thank you so very much, Sandra. Well, I was just reflecting over prevention, because I think prevention is also key. And perhaps we need to sort of educate our colleagues about prevention. I mean, we should showcase the different examples of prevention, for example, against NCDs, so they really understand what is prevention. And prevention is also about lifestyle habits. And as such, we have now a project in the region of Stockholm where patients at risk for diabetes type 2 are enrolled into a program where they actually get health coaching and lifestyle coaching from pharmacists and other health coaches within the region of Stockholm. And they also get 625 euros for lifestyle changing habits of different kinds. And what's interesting, I think there are 2,000 people enrolled in the program, and after 4 months, 40% of them are not at risk any longer for acquiring diabetes type 2, thanks to these counseling activities, activities from pharmacy, continuous follow-up. And what's interesting as well, everything is more or less online. So, I mean, it's how we can actually use the digital tools to be where the patients or our consumers are today. Just a comment.
That's great. Thank you.
I just want to add one really quick thing to Jaime's discussion about having practical tools from the conversation from screening to communication with clinicians, so GPs and other healthcare professionals. So it really goes to Karina's comment as what can industry end up doing to help. One thing that industry has that we don't necessarily have is an easy relationship with most of the healthcare professionals. So most GPs, most specialists in the community. One of the issues is that we see within pharmacy, especially here, is where we had 20 different programs implemented at a time with 20 different forms that ended up where it came to the GP's office and they had no idea what this was or how this went together. So if they could utilize the sales force and the teams to come up and say, we're initiating a program that's going to focus on CKD, you may see some of these forms come to practice. This is some of the recommendations of how you can work with your pharmacist to end up helping that process. I think that would really help to get some of these programs off the ground and make them much more sustainable as well.
That's great. Lars, do you have one more comment before we?
Yes, thank you so very much. Well, I think that in the context of individual care, a trusted multidisciplinary primary care team is very important in supporting the patients and also in prioritizing and identifying different individual care goals. So I think that the team approach is very important for us as well to focus on when we try to develop our new services and also get the healthcare administration to improve, for example, our involvement in the fight against NCDs, because teams approach individual patient care and taking into consideration, you can say, the patient's cultural preferences and stage of life, access a wide range of problems, could be mental, physical, chronic, acute, communicable, non-communicable. So the team will be responsible for assessing the health needs of the patient and providing a safe and evidence cost-efficient management through appropriate use of health technologies, information, etc. So that could perhaps be one way of going forward as well, to focus a lot more on the team, because I think that we, on a general perspective, within healthcare work too much in silos.
100% agree. All right, Catherine, you get to ask the last question, then we'll clue up.
Thanks so much, Sandra. So I think what I'm taking from this is we need to think about patients as individuals and also pharmacists as individuals, address their concerns and perhaps their confidence at various stages of whether they are treating diseases or living with a disease. And then, of course, Karina, we've just heard that teamwork, isn't the phrase teamwork makes the dream work? So I come to you to say, how can industry partner with the pharmacy profession to address the unmet needs of chronic kidney disease in your perspective? Karina?
Yeah, so I think, lots of food for thought today. I think one of the things that, is always coming across is the education part. And I think we do end up spending a lot of time and investing a lot of resources into developing education. So I think what we need to think about is how do we disseminate those materials as well to pharmacists? And I think, this group and you, Catherine, and your group, I think it could be a great partnership for the future in terms of, how do we work with you and kind of using your leveraging your contacts as well with, kind of really robust education materials around disease, and, and how does that get filtered down into country societies and country pharmacy groups as well. So I think, this is hopefully the start of a great partnership. And I think there's some great opportunities with all of this group as well, with all the expertise you have about what does work, what doesn't work, and where should we focus our efforts. But I think, education. I think the other thing, and I think Jaime mentioned is, we're spending a lot of time, we've internally quite a lot of people working on digital innovation. And I think it's how do we think about the pharmacists, when we are doing some of this investment into digital innovation and what can work in different countries. I think the biggest challenge is, of course, every country is different in how pharmacists interact with their healthcare professionals, but also countries are different in terms of infrastructure, about whether pharmacies have got access to patients' electronic health records, etc. And it's how do we then create almost this toolbox of different things that different countries can leverage, so you've almost the right tool for the right country at the right time, for the right pharmacy. So I think there's lots for us to think about, and hopefully this group we can come back together and really think about what are the two big things that we work with you on, but I think there's great opportunity, and I think today has just highlighted again the fantastic opportunity that we do have to partner with pharmacists in the future around chronic disease management.
Sounds super. And we love the toolkit, the toolbox approach, Karina. And let me tell you, you may say all the countries are different, but there's so much commonality that pulls us together. If we have a menu approach, I can tell you some people will pick and mix and they'll speed ahead of other countries in terms of delivering services such as CKD. Sandra, did you have a few closing remarks or reflections?
Yeah, Catherine, thank you. This has been really a fascinating and a great conversation. And I do think it's just the start, and this is kind of my thinking. As humanity, we are at one of the most teachable moments in healthcare right now. We're reimagining healthcare across the board, and pharmacists are really powerful agents of change because of access, because of all of the things they're doing. We can make science and evidence approachable for everybody, improving community health participation, because all boats will rise. The COVID reset really presents many opportunities in chronic disease management, starting with CKD or any of them. So let's be health entrepreneurs, let's investigate these changes, and let's get involved as we need it. And if you take anything away from today, we can be those health entrepreneurs that are really helping at this teachable moment. So that's kind of my thinking. It's just a great team. I wish we were doing this in person, sitting around a fire with a cup of coffee, maybe the next one in Spain. And Jaime, I will be there. So it's very exciting. Catherine,
we'll look forward to seeing everyone in Seville in Spain in September, our global congress. Delayed from 2020, it will be all the sweeter when we can meet each other. But that shouldn't stop us, Sandra, from doing small steps. I've really taken Michael's point on board. You can cover a lot of grounds with small steps. You don't always have to be sprinting. And I think most people would find the small bite-sized pieces of progression to be much more palatable, much more easy. Consider it, Jaime, the tapas of professional development rather than a full main course. I think we need to pick up on some of these things, revisit them when we next meet, and then demonstrate evidence of impact of this alongside other NCDs, prevention, safety, and NCDs. This pulls it together so beautifully at our Health Ministers Summit next year. I look forward to it. Thank you so much, colleagues.
Thank you, everybody.
Thank you so much.
Thank you.
Thank you so very much.
Thank you.